Girl in Chesapeake still is recovering after developing a rare condition associated with COVID-19. It's called multi-system inflammatory syndrome. Although it's uncommon, a pediatric specialist says there has been a rise in the number of cases in Hampton Roads. Ann Sparacco has more on the symptoms and the girl's parents' concerns about getting their daughter vaccinated.
We've actually seen a large increase in the cases of MIS-C.
Dr. Laura Sass with the Children's Hospital of the King's Daughters says she is seeing more patients with COVID-19 develop the rare condition called multi-system inflammatory syndrome, or MIS-C.
But we've actually had almost 60 children admitted to CHKD since the beginning of the pandemic who have been treated for and diagnosed with MIS-C.
It can cause stomach pain, skin rashes, dizziness, and more. Those are some of the symptoms 12-year-old Madison Perry experienced in September of 2020 after she got COVID-19.
It was really scary. I was afraid that I was never going to play softball again.
More than a year later, Madison is feeling better, but her mom, Haley Robinson, says they still are monitoring the long-term effects on her daughter's health.
I feel like we're still being a little bit affected just from doctor's appointments.
Robinson says because there isn't much data available regarding how a COVID-19 vaccine would perform in children who had MIS-C, she is waiting to get her daughter vaccinated.
I'm not, against it. A bunch of our friends have gotten it, and because of that MIS-C, we don't really know what to do.
Though Sass understands why parents may be hesitant if their child had MIS-C, she wants them to know the vaccine should be safe.
That's when you have that conversation with your pediatrician and be like, okay, what do you think?
In Norfolk, I'm Ann Sparacco for 13 News Now.
Dr. Sass says all recorded patients at CHKD with MIS-C are unvaccinated. She says the vaccine is still the best way to prevent COVID, which will help prevent the rare symptom.